Alright, I told you I was going to tell you what I used to get rid of my gingivitis, and this is what I found. It's called a hydrofloss, and what it does is it shoots a jet stream of water basically around your... What you do is you run that jet stream with this little device, this little tip here, along the gum line. Like say this is my gum line right here. That's where I'd shoot this jet right along that gum line, just like that. And that jet stream of water will clean out the gums. What it does is it can shoot up to 60 psi, which does not hurt your gums. Of course, you wouldn't want to use that high setting if you were suffering from a severe gingivitis or periodontal disease. But anyway, you can shoot up that high and it doesn't hurt healthy gum tissue. But what it does do is it creates like this little suction pocket as it goes by the gum, and it pops everything out, basically sucks it out. And this device also uses hydromagnetics. And you know, the jury's out on this. Well, not really, sort of, kind of. It's been written up in dental journals, and supposedly the facts and science are there to show that it works. But the hydromagnetics basically create a charge that is different than the charge on the bacteria, so it basically has the effect of washing your teeth, not just with the water jet stream itself, but also hydromagnetically getting that calculus and other tartar buildup off the teeth, off the gums. So it's a very powerful device. But what I found out is I actually used this device for about 6 months, went back to my dentist, they told me, hey, your gums are fine, you no longer need the root scaling and planing any longer. And I was like, cool, so what I'm doing must be working. They actually told me to keep it up. And again, this is not part of the care that they taught me to do. They said I was a compliant patient, but I'd already been complying with everything they said, and it wasn't working, and I went out and found this device, and this actually worked. Now what I found out is this device, after 5 months of using it, it got rid of my gingivitis, got my gums cleaned up, so I no longer needed that root scaling and planing. But it was doing a good job, but it was kind of slow. And I added something to the mix, and it was this very powerful oral rinse that it's got an oxygenated compound in it called Oxy D8, and that's basically put 2 capfuls. I would just take this up, shake the bottle up, pour 2 capfuls, put it inside the hydrofloss, fill it. That did a much better job, and my gums moved along and got even healthier at that point. So I was very, very happy with these 2 products, the hydrofloss and the Oxy D8. Okay, now again, my disclaimer, that's what I did to heal my gums. Okay, I'm not saying it's going to work for you. What I am saying to you is you need to go see your dentist if you've got bleeding gums. There's a link to my site here, and you can check it out, the other things I've written to learn more about gingivitis. And that's pretty much it. If you have any questions, you can find me at my website, tobeinformed.com, and there's a section there called Ask Dave a Question, and you can click on that big red button and you'll go to a forum where you can ask me a question and I'll answer it on the site. You can also go to AskDaveAboutHealth and .com, and it will take you right to that spot.